Hello, welcome to the Robert Parangi podcast. We are here to help you on your journey to getting healthy. So let's get started. Okay, this is Dr. Parangi. I'm speaking with Dr. Vaimakis. This evening I'm interviewing her. She's a bariatric surgeon who has had extensive experience with weight loss surgery. So let's start out with a very simple question. What is your approach to a patient, Dr. Vaimakis?
Yeah, so thank you for having me on. I really believe in taking a very individualized approach to my bariatric patients.
Mm-hmm.
I use a multidisciplinary team that is composed of nutritionists, an exercise physiologist, health coach, therapists. And we try to customize our plans to make sure that patients have the support that they need, not just preoperatively, but postoperatively, so that they can have the maximal success with weight loss.
Great. What kind of operations do you offer?
So right now in the U.S., there's a couple of different operations. Probably the most popular would be the sleeve gastrectomy, where we take off a significant amount of stomach so that patients are forced into eating less portions of food. There's also the gastric bypass, which is a little bit more involved. It's better suited for patients that are diabetics. There's also the duodenal switch, which is a little bit more involved, more meant for patients at much higher BMIs, and very few lap bands being done nowadays for patients who are looking for something that's really just much less invasive.
These operations are performed laparoscopically?
So these operations are performed laparoscopically. I switched my practice over to robotics. Using the Da Vinci robot, I think, has offered an extensive advantage to patients. There's much less pain. Postoperatively, patients take little, if any, narcotic medications afterwards. And I think there's really been a significant advantage in terms of the technology that we've really adopted and seen significant improvements with the robotic platform. Yeah.
What kind of clearances do you require for the patients to be cleared for surgery?
So every patient is required by insurance and by most hospitals that are what's known as bariatric centers of excellence, which holy name is. And so that includes an evaluation by a nutritionist as well as a psychologist preoperatively. And then depending on the surgeon, the clearances will vary. In my practice, I like to do a very comprehensive check. So we look at the heart, the lungs, we check for blood clots, blood work. Yeah, it's a full comprehensive workup. These are elective surgeries, so we want to make sure that patients are in the safest possible status before we proceed with surgery.
And how long are they in the hospital once the operation is done?
So depending on the operation, patients routinely will stay about 24 hours. So typically they'll go home the next day.
It's quick.
It's relatively safe. I think most people still have old ideas that these operations are in some way super dangerous or risky.
Yeah, no.
And they're really not.
They're really not. Then the other thing that a lot of people have the wrong impression about is age a factor?
So a lot of studies that looked at different age groups, and I think the biggest concern was for the older age group, and there were a number of studies that looked at bariatric surgery in patients over 65. And really, there was no significant difference in terms of morbidity, mortality, meaning there was no added risk. Patients did just as well, and I have quite a few 60, 70-year-old patients that do.
Yeah, you operated one of mine just a couple months ago. She's doing great. She's lost a lot of weight. You've given her life back because she couldn't lose the weight. She tried. We tried diet. She was not a good candidate for exercise, and I told her she thought she was too old to get the operation. I said, no, you're not too old. Go ahead and see Dr. Vaimakis. And I think she's very happy she did.
Absolutely. I think it really gives them, the ability to enjoy the later years in their life. So there's no age limit with this.
Sure. Great. I think that I wanted to interview you just to get your perspective out there and get your input out there. Because I really think that it's probably an underused operation. A lot of people are scared to go, or they don't want to go, or they think they can't go. And I think that we're probably going to see a lot more of these operations as public education gets better.
Definitely. These operations really give people their lives back. We get rid of diabetes, high blood pressure, sleep apnea. It's really, we're able to turn their lives around.
Yeah, diabetes goes away, especially with the gastric bypass. The GLP level goes up. Is there any other myths you'd like to debunk?
I think it's the complication rate. I think that people, still feel that these are very risky operations. And I can tell you that over the years, these operations are safer than taking your gallbladder out, having a knee replacement, colon resection. Again, unlike other types of operations, these really give patients back the ability to take their lives back and get rid of very serious comorbidities that they're dealing with. So I wish more patients would take advantage of it because I really do think it's life-changing.
Yeah, I have several patients who have tremendous joint problems with all the weight, and I'm trying to convince them to go see you, and they just keep putting it off. They have excuses. And I'm like, I really think it's gonna make a big difference in how much pain medication you're gonna have to take to continue to walk.
Absolutely, and I think that's probably the biggest complaint that I hear is that patients wish that they had done it sooner. Yep. I agree with you. Great. Well, thanks so much for having me on.
Thank you so much.
Appreciate the opportunity.
Thanks for being on with us, and look forward to seeing patients together in the future.
Absolutely.
All right. Be well.
Take care.
Good night. Thank you for tuning into my show. If you'd like to call for a consultation, my office number is 201-265-7564. Thank you.